So first, I would like to ask for your permission to use this video for educational purpose and on internet. Do I have your permission?
Yes, yes.
Good, thank you. Now
That's
tell me about your symptoms before the surgery. How many years did you have those symptoms?
I have suffered with them for years and years and just
Like 5, 10 years, or how
over
long?
10.
Over 10 years. Now, now you had a scoliosis. You had a, and that wasn't a trivial thing. You had a scoliosis with a curve angle of what we call side bending of the spine of 36 degrees, and that is when you were laying down. When you were standing up, that was even worse. And this has been going on for many years. 1 to 10, how bad was the pain that you had?
It was bad. It got to the point that I just would have to sit down and just say, this is it, you know. I was ready, in fact, I was ready for this is it.
Yeah, well, you know, how far could you walk before?
Well, I still working 10 years ago, and I retired.
Mm-hmm.
And because of my back, I retired.
Yeah.
Well, I'll be 72.
Yeah, but you know, how old are you now?
80.
80, but you had this severe pain, 1 to 10, when the pain was bad. How bad was the pain?
It was, at that point, it was probably 8.
8?
You know.
Was it 8 every day?
Every day.
Well, that's a lot of pain. Now, I know that you met other neurosurgeon, and we don't need to mention the name, but they probably told you that this is too much for your age group to correct the problem, right? And they said, I remember that you got a stimulation device for management of the pain in the spine. Tell me about that. What was your conversation, and how did you guys come to the decision, instead of correcting the scoliosis, to put a stimulation device in? Tell me about it.
Well, it was getting shots, doing shots first, and which didn't work. So then I had the surgery down in Minneapolis. Whatever he did, tried to go down in there and make pain for the nerve.
Yeah.
And that didn't work. So then I'm back to Alexandria again, and went to the other spine center over there.
Yeah.
See what they could do. And they said that putting in that device should take care of
your pain.
About 40%, 50%, whatever.
Okay. Well, did the device help you?
No.
No. Well, the way I tell my patient, that device can be sometimes helpful, sometimes.
Yeah.
But pain is not the problem. Pain is like a noise of a smoke alarm. Pain is telling you something is wrong and we have to take care of it. And that something, in your case, was practically your scoliosis, that the discs were pushing on the nerve. And and that device, what it does is like it resets the smoke alarm noise, but it doesn't stop the fire. It doesn't correct the situation. In your case, did that device help you at all?
No. In fact, I think what happened is the pain in my leg got worse.
Yeah.
Then,
And that's sort of when you came to us. But I do understand that with your age group, when you're 80 years old, doing a scoliosis correction, it's a big surgery. It can be easily 10-12 hour surgery, but the way we do the surgery, we could do your surgery actually. The part that we correct the scoliosis was about 2 hours. We spent a little more time to get that stimulation device out. And if you are okay with that, I like to look at your back and just explain on your back what we did. Okay? Now, I'm just going to, if you turn a little forward, I'm going to bring it up. And, on the top here, we see that where I opened it up, took those paddle electrodes out, and that is the biggest incision actually you got. And here is where the stimulation device was, the battery was in place. Our incision from our surgeries are barely visible. These are on the sides. These are the incision that we use. Those are the best healing ones because those are small incision and they have been healing pretty well. And obviously this was as big of a surgery as it can be. I'm going to turn to the computer and we are going to see that we did fuse and correct your scoliosis from L2, 3, 4, 5, and S1. the curve angle, the side bending that used to be 36 degree when you were laying down is now 9.4 degree. So we correct most of the scoliosis in your back, but you see there is lots of metal in to correct the situation. How have you been since the surgery? Tell me about your pain since the surgery. First, the pain in the back.
Since the surgery?
Yeah, and right now, I mean, how bad is the pain in the back?
Right now, it's probably 2.
2, okay.
Yep.
And then
Very little pain.
Very little pain. Now, before the surgery, you had as well leg pain, correct?
Yeah.
How is the leg pain?
For some odd reason, today I got the pain in the leg.
Mm-hmm. Okay, 1 to 10, how bad is it?
Oh, I'd say it's at least maybe 5.
5? Okay, how bad was it before the surgery?
Oh, 10 some
10,
days.
okay.
Yeah.
So 1 month after the surgery, everything is going the right direction. Hardware, we looked at it, is in a perfect position. As a matter of fact, I want to turn around as well, show you with all the twisting in your spine, with the way we are able to do the surgery. I'm just going to get some of the information out here. These are the screws that we put in. They are in perfect position.
Mm-hmm.
And we use 2 C-arms, 2 X-ray machines in 2 different planes that enable us, even in difficult situation like yours, put the screws exactly where they need to be.
Mm-hmm.
And sometimes as well on the bottom we put the screws that they grab on the front hard part of the bone. We call them bicortical. That gives you additional stability. So this is a big surgery, and considering that we went through that big surgery, your symptoms are pretty mild. And but overall, do you feel that so far after the surgery, you're going the right direction? How do you feel about your symptoms?
Oh yeah, I feel like we're really going the right direction.
Yeah, excellent.
I
excellent.
do.
Now, this has been going on for obviously many tens of years. This situation, and many times patients as well are scared about going through the surgery, because the surgery can be open old-fashioned way, it can be really damaging and so on. But tell me, how long did you stay in the hospital, you yourself, after this big surgery?
This one here?
Yeah.
3.
3 days. 3 days. You stayed 3 nights in the hospital, which is, considering what you went through in your age group, is pretty good actually. Now, after the surgery, obviously people need help to walk. But when did you start walking after the surgery? Did you walk same day or next day?
The second day.
Second day.
Yeah,
So next day after the surgery, you walked?
Yep.
Okay. Yeah. And that is as well, pretty good actually. Again, for what we went through, and this is again big surgery. Now, overall, do you think it was so far worth it? The surgery, was it worth it so far?
Yes.
Yes. Yeah. Excellent. Well, any other comment? Any question? No.
I don't think so.
Okay. Well, thank you so much for the interview. I appreciate that.